Welcome to TTV. Today we're here in Kansas City with Dr. Diane Voss. She's actually in Independence, Missouri, right outside the Kansas City city limits. And I'm fascinated by her model. She's a direct primary care physician. Her practice is named Reinvent Your Health.
Yes.
And it's a cool model that I'd really like to have her talk with you about today. We were referred to her actually because of the fact that she has combined both natural medicines, basically open to whatever you want to do, as well as standard medical care. So it's a beautiful model where you can come in, get education, explore options, and not necessarily ride one railroad train to wherever your doctor wants to take you, but that you get to help be the conductor and decide what your healthcare plan looks like. So we're going to talk to Dr. Voss about that in a minute. So thank you, Dr. Voss, for being with us today.
Thanks for having me. I think direct primary care is possibly one of the avenues to improve healthcare in the United States with the crisis that's going on right now, because my feeling that healthcare in some ways is broken. In 2015, I believe 85% of Americans never met their deductible. So they were paying for 100% of their medical care plus paying an insurance company, on average, depending on age and other factors and all these things, about $600 a month as well. There are several different models. The model of direct primary care, which is available in several areas of the country, is that instead of paying toward your deductible every time you see the physician, you pay a monthly amount. And for that monthly amount, you're able to call, contact, text, email, visit your doctor as often as you need to.
For the same flat fee per
For
month?
the same flat fee.
So no additional charges once you pay your monthly fee?
Anything that's done in the office, like pregnancy test, EKGs, spirometry, minor laceration repair, skin tags, depends on the doctor. We all have different skills. Anything that's actually done in the office is no extra fee. We also have the ability in most states to dispense medication, often which much less markup than what you're going to find in the average pharmacy. Most of us have access to excellent cash pricing for certain procedures and for some specialists and for labs.
Wow.
And we make the choice to pass those savings on to the client. The other cool thing is I don't ever order anything without going over the price, what people expect. And sometimes I say, I want this $100 worth of lab work, and the person says, I can only afford $50 this month. And I say, okay, well, let's do these 3 things, and can we do this next month? And so it's much, you already know what's going to happen. So if you have an HSA or something, you can fund it appropriately.
Wow.
So it gives people options, but physicians who do direct primary care do not accept insurance. They just do their monthly fee. So this is different than concierge. Concierge
yes,
doctors take insurance, so they're still bound by the rules of insurance and the limitations of insurance. Plus they have a fee, and that's an excellent model for some people. The model that I chose is because I'm not bound nearly as much by what the insurance allows. I was going to get an MRI of the back on somebody, and we tried all types of things first. I'm very conservative financially, and finally decided that was the best choice. Person paid for it. They go to the imaging place, and they're like, well, do you have your prior auth? And the patient's like, I don't need one.
And probably paid what, half, third of the price of the going rate?
It's a little hard to say, and I'm not allowed to advertise, but let's just say it was a percentage savings that made the person happy and made them able to afford to get the test done.
But they knew before they went there what it was going to cost.
They knew it was going to cost.
That's wonderful.
And, a similar thing is Surgery Centers of America in Oklahoma, where you pay cash, and sometimes it's cheaper to go down there and stay in a hotel for a week and get everything you need done than it is to get it done in the rest of the system. It's not something that's going to be the best answer for everybody, but a lot of people find it an awesome alternative.
That's wonderful.
So in this model, physicians who do direct primary care do not accept insurance. They don't sign on to insurance contracts. And by making agreements with various other providers, we're able to offer people very, very affordable cash pricing.
Oh, that's nice.
So this gives people an opportunity to take back their health care and to actually get care, because unfortunately for a high percentage of Americans right now, their health plan is to not get sick.
Mm-hmm.
And, you know, sometimes that works out really great, and sometimes it's a little bit of a problem. The other issue is that most medical issues are much more solvable or much more treatable if we actually find them before the person's symptomatic.
Mm-hmm.
So there's a few things like thyroid problems or anemia or high cholesterol or things like that if you can address them before they become a true diagnosis, your success rate goes way up. People feel better. And you're learning lifestyles that actually make a huge difference. Our other idea is to try to reach people when they're younger, so they can start making healthier choices earlier on. In my practice in particular, I have an ardent interest in natural and holistic healing, which is true of some direct primary care offices. Everyone has a little bit different flavor because the physician has an opportunity to focus on their area of interest, and it's always good to have the doctor really interested when you have something wrong with you.
It is.
Because it makes for a much better partnership, regardless of what you're addressing. You know, if you call the plumber, you want to be somebody who enjoys plumbing and is not having somebody tell them, well, you have to use this kind of pipe, or what, you know, yeah, there's code. We still have to be good physicians. We're not going to do things that aren't healthy or not safe. But this gives us a chance to spend time with people and get to know people. Mm-hmm. So as a internist for hire, when I was owned by a large company, which got bought out by another large company, which got bought out by another large company, every time they got bought out, there were just more and more rules, until I was in a place where I was told that I could spend 7 minutes with every person. Wow. And I could only see them for one problem. Well, very often when you have something complicated like diabetes, you have that in association with heart disease, arthritis, maybe depression. And so if I just address one problem at a time, I see two things happen. Number one, you're having to come back all the time. And I don't know about you, but I can't afford to take off that much time.
Nope.
And second of all, none of these issues happen in isolation. Mm-hmm. I mean, it's true that you go see your cardiologist for your heart problem. But the reality is your body kind of is in one piece, hopefully. And those pieces kind of work together. So if you're in a situation where you can address everything together, I think you're going to have a better outcome. I love having specialists to refer to. I love that I don't have to know everything, but at the same time, if the patient and I can sit down and come up with a plan that encompasses everything, I think it's going to be a much more doable plan. So when I was owned, I made a good living. I worked an ungodly number of hours, which wasn't healthy for me, and I had 3,500 patients in my panel, which means that if I saw you every 3 months and you had to cancel your appointment, the next time you could come in with me, I had a 9-month waiting list at one point.
My goodness.
You know, and I don't know if that's because I was good or if that's because there weren't enough physicians in the system. It's a little hard to tell sometimes. So the other problem was my patients were being seen by the nurse practitioner on a regular basis, and I love nurse practitioners, and they are amazing people who do amazing jobs. And there were times when the patients made the choice to see the nurse practitioner because they didn't want to wait around for me, and I think that's great. But when you get a situation where the person literally can't get in to see the person they want to see, that takes us a step further away from a good relationship.
Yes.
The other problem is somebody would get sick and I couldn't fit them in anywhere. Or if I could fit them in, then it was a 2-hour wait because I'm running behind because I'm trying to see more people than I really have physical ability to see. And I started really worrying about whether I was going to make mistakes or not when I'm seeing that many people. Mm-hmm. And when I'm seeing that many people, it's harder for me to remember those little details. Yes, I remember you have diabetes, but I might not remember that the fact that your son has schizophrenia is a huge stressor for you, because that's going to affect your food choices, that's going to affect your mood, that's going to affect what you can and can't do in your home. So the direct primary care model, we limit our practice to somewhere around 500 or 600 patients. The person pays a monthly retainer, and because of that, we are able to spend between 30 and 90 minutes per visit.
Oh, wow.
So my new patient appointment is 90 minutes. My physical exam is 90 minutes. My routine follow-up is 30 minutes. This is kind of complicated, we need to dig through some stuff, is 60 minutes. So I get to know people. I can figure out what their triggers are, what their blocks are, so what knocks them off their path, what keeps them from getting back on their path. I can actually listen. I have time to sit down. It's very common people come in and say, I've seen 8 doctors and nobody knows what happens. And sometimes when you just sit back and listen to the entire story from beginning to end, you go, oh, I see a pattern here. And sometimes it's not even me. Sometimes the patient's like, oh, I see a pattern here. It makes my life really easy, because I have to convince them there's a pattern. It already became obvious just in the interchange, which is really cool. It also makes us partners.
Does.
Which is far more effective, because the reality is we all know what we're supposed to do. You don't need some doctor to say you should get more sleep, you should take care of yourself, you should find a job that you really like, you should eat right. We all know what we should do. If we actually knew how to do it, what we should do, we'd already be doing it, and we wouldn't be in the doctor's office in the first place.
Beyond that, though, a lot of people know what they should do, but what they can't find is once they've made the choices that put them where they're at, which may have been a happy or a sad path, it's getting back. So what also impressed me when I heard about you is the fact that you incorporate standard medical care, and because you're holistic in your look, you're an internist, you just don't specialize in the one, you look at that whole person. So what other things do you bring into your practice? Because in direct primary care, for you anyway, it's not just about, I'm going to understand that we're going to dispense medication, I'm going to track on it, we're going to see your results. There's something more beyond that. So what things do you incorporate in this as you do this discovery work with patients?
We really work on lifestyle. What would it take to make it fun for you to move more? What would it take for you to make just a little bit healthier choice in your eating? What would it take for you to understand the difference between healthy fat and less healthy fat? What would it take for you to make, maybe not go from A to Z, but maybe move from A to D along the healthier path? What would it take to make you remember what brings you joy?
Yeah.
What would it take for you to work on the relationship with your son? I also do a lot of vitamins and supplements and those types of things, because there are a lot of people who have side effects with medication. There are some people that want to try different things. I also have a very considerable group of people who I have found and have great feedback on some of the alternative things. So, there are times when seeing a chiropractor is going to get you where you need to go much quicker. There are times when acupuncture really helps in pain control. And there's studies for these things. All these things are things that have been well studied, well vetted. There are times when there's a belief system that needs to be laid to rest because it's not serving you anymore. And sometimes you need permission to lay that to rest. And, sometimes I find that a lot of times I'm not doing the work. It's really cool because I ask a person for their story. I said, what's the problem? And I hold up this little mirror. What's the problem, and what would it take for you to fix that problem? And then I turn around and show it back to them, and they've already told me what they need to do, how they can make it happen, and how they got there. And the light bulb goes off. And I'm like, wow, I can't even take credit for that.
That's wonderful.
But it's fun.
But it's taking the time to help them through that path of discovery, isn't it?
Yeah. And this is the other thing. It's a lot more fun to be in a room with someone who's happy.
It is.
So if you're a patient and you come in and your doctor is loving what they do and they're happy to see you, that in and of itself is a better place for the patient to be. And if you're the doctor, and you actually have time to go where the patient needs to go. I mean, you know, if someone's crying their heart out and the 7-minute bell goes off, that's not a good time to stop. You know, sometimes you need the luxury of being able to slide a little bit and adjust a little bit. The other cool thing is, most of us make home visits.
Really?
Well, there's nobody to tell us we can't.
I like that.
How cool is that?
That is awesome. It's another way, if you think about trying to figure out how, if there are lifestyle factors, just looking at that environment can oftentimes be very helpful.
Be surprised. You know, people don't volunteer that they have to sleep in their recliner.
Yep.
And I do a home visit, and it's obvious that they're spending all their time in their recliner. And when I say, well, you know, how's your bed? And they go, it's fine. It's fine, because they're walking past it to the recliner, you know. And sometimes people are just embarrassed. You know, sometimes we can prevent a trip to the emergency room. If someone's developing, say, heart failure, and you can get them in and see them and make adjustments to their medicines, and because they're paying you a certain amount a month, you can actually see them several days in a row, and it's not costing them any extra.
Oh, that's nice.
And people can text me. How cool is that? You know, I had a lady that developed a rash, and she sent me a picture at 5 o'clock in the morning. I'm like, oh my gosh, why did I decide to do this? But it was shingles, and the cool thing here is that I actually remembered that she babysits for her granddaughter who's less than a year old, which means her granddaughter has not had her chickenpox vaccine. So I was able to remember, wow, you shouldn't be around your granddaughter. She hasn't had her chickenpox vaccine. Yeah. We don't want her to have chickenpox.
Yeah.
And so there's medication that helps that go away faster.
Mm-hmm.
There are natural things that help that go away faster. I gave her a couple of options. She's like, I want drugs. And I'm like, okay.
And if she hadn't, you'd go, okay. Right?
Yeah.
So it's nice because you're meeting people where they're at, whether it be through natural medicines,
absolutely,
or herbal remedies, or vitamins,
absolutely, and if somebody wants to do something a certain way and I really don't think it's in their best interest, I give them that information. You know, and they can actually argue with me, and we have some very fun discussion. People bring me articles all the time. I love it because I learn so much.
Well, how do I contact you here? If I'm living in the Kansas City area, how do I find? I know it's Reinvent Health.
It's Reinvent Your Health. I think the best thing to do is to go to the website, reinventyourhealth.net.
Okay. And we'll provide that below.
Get an idea of whether this is something that might work for you. There's actually a group in the Kansas City area that is Direct Primary Care, Midwest Direct Primary Care Association. And that has a list of all the direct primary care doctors in this area.
Oh, that's nice.
You can call us, 816-272-4877. And if you just want to drop by and have a cup of coffee and see if you like the vibe, you know. Because if you walk in and it doesn't feel right, then don't hang out.
Well, it's an unusual doctor's office, just so that you know. You come in, it's got beautiful carpet, it's got plants out there, it's got a very homey feel. I mean, it's a very different feel. It's one where I feel like I'm walking into a health spa instead of a physician's office.
Oh, that's a great compliment.
So well done. Thank you for visiting with us today. Check out information below on how to contact Dr. Voss, and wish you were in the Denver area where we're at. Congratulations to those of you in the Kansas City area.
There are direct primary care doctors all over the United States. So
it's a growing thing.
And we don't advertise because it's word of mouth, and we want people who feel like this is going to be a good fit.
Good. Thank you.
Thank you very much.